Hi there, Tom here from CoverRight.com, the simplest way to navigate Medicare. Today I'm bringing you a video on how to choose and compare different Medicare Advantage plans, which is a question we get every day here at CoverRight.com. So did you know that on average, according to the Kaiser Family Foundation, there are 33 Medicare Advantage plans available to each Medicare beneficiary in 2021? So that means there's a lot to choose from, a lot of plans that have different options and benefits and features that you need to compare and weigh up in order to work out which plan is going to work really well for you and which plan matches your healthcare and financial preferences. Deciding on the right plan will be based on your specific personal situation, what medical needs you have, your financial capacity, what prescription drugs you need to take, and other health preferences as well. First off, let's do a recap on what is a Medicare Advantage plan. So Medicare Advantage plans, also known as Medicare Part C or just Part C, are bundled alternatives to original Medicare that are offered by private insurance companies. Now, under original Medicare, you are covered by Part A, which is hospital insurance, and Part B, which is medical insurance. But when you decide to enroll in a Medicare Advantage plan, that Medicare Advantage plan essentially replaces that Part A and Part B coverage, and you'll likely have access to more benefits like Part D prescription drug coverage for your prescription drug needs. And often you'll also have access to vision, hearing, dental, wellness memberships, and other benefits that are offered by your Medicare Advantage plan provider. One important thing to remember with both original Medicare and Medicare Advantage plans is that you'll always have to pay your standard Part B premium. And in 2021, that starts at $148.50. And it can be higher depending on your level of income. Now, you probably know that a lot of Medicare Advantage plans have a $0 premium, but some Medicare Advantage plans that offer a lot of extra benefits will have one great feature about Medicare Advantage plans is that you're not tied to a plan forever. You can amend your coverage during the annual enrollment period each year, or also during the Medicare Advantage open enrollment period, which also happens each year. Medicare Advantage plans also aren't allowed to deny you coverage for medical reasons, so you'll always be able to find a new Medicare Advantage plan to enroll in without medical underwriting. One of the first things you might notice is there are two major types of different Medicare Advantage plans. The first one is health maintenance organizations. 62% of all Medicare Advantage plans are HMOs or health maintenance organizations. These are plans where a primary care physician oversees your overall health care. Plus, your choice of doctors and hospitals is limited to those under the HMO network, except during emergencies. The second type is a preferred provider organization, or a PPO. These represent about 34% of all Medicare Advantage plans. These plans are typically more flexible than an HMO. With PPOs, you're free to visit the plan's preferred providers, also known as in-network providers, or any out-of-network that accepts Medicare. Other types of Medicare Advantage plans include special needs plans, which are a subset of HMO plans and are typically for people who have a chronic condition or are dual eligible for both Medicare and Medicaid. Now, when you start comparing the Medicare Advantage plans available in your area, one of the most important aspects that you'll need to consider are the costs associated with each different plan. The first thing that you'll probably look at is the monthly premium. So like I said earlier, you'll always pay the standard Part B monthly premium, regardless of whether you stay on original Medicare or whether you join a Medicare Advantage plan. Now, you need to add to this any monthly premium for your chosen Medicare Advantage plan. In 2021, 54% of all Medicare Advantage plans have a $0 premium. Some PPO plans have higher premiums than HMO plans to compensate for the added flexibility of the network. The next cost to consider are the annual deductibles. So deductibles are the amount that you need to pay for your healthcare services out of pocket before the plan starts to pay anything. Now, depending on the Medicare Advantage plan that you choose, there may or may not be an annual deductible that you need to reach before the plan starts paying. But you may find that a plan has a prescription drug deductible if that plan bundles prescription drug coverage with the medical and hospital coverage as well. The next thing you'll see with most Medicare Advantage plans is a list of co-payments, which is a flat payment that you make for each medical or hospital visit or service, and a list of co-insurances, which is a percentage of the underlying cost of that medical or hospital visit or service. Each plan will have a list of its own co-pays and co-insurances for different medical and hospital services, such as ambulance rides, inpatient stays in a hospital, laboratory services, tests and scans, and other outpatient services like outpatient x-rays or rehabilitation services. It's really important to carefully review and consider the co-pays and co-insurances in a plan's summary of benefits for the services that you expect to use. And that's something that licensed agents at CoverRight.com can help you to review and compare. The last cost feature to consider under Medicare Advantage plans is your maximum annual out-of-pocket cost. Now, the federal government actually mandates a maximum amount for your out-of-pocket expenses under any Medicare Advantage plan. In 2021, the maximum for services received from in-network providers is $7,550. And for services received from both in-network and out-of-network providers, it's $11,300. Once you've reached this limit, the Medicare Advantage plan will pay for 100% of any other costs above that limit. Some plans may have lower limits than the federal guidelines, so it's important to think about your possible catastrophic cost scenarios and compare the maximum out-of-pocket costs. One important thing to remember is that while a plan may look cheap because it has a $0 premium, it might have higher costs in other areas like higher deductibles, higher co-payments for other services, and a higher maximum out-of-pocket cost. So there's a few additional factors that we think at CoverRight.com are really important for each beneficiary to consider when making the final decision on which plan is right for them. The first one is to consider your personal financial budget alongside your long-term healthcare needs. The key things to understand when comparing plans is what your regular monthly costs will be. So these are things like doctor visits to see a specialist, and other services that you expect to use regularly, as well as if you are comfortable with your out-of-pocket cost obligations in an emergency or in a catastrophic scenario. The next thing that you really need to think about is your prescription drug coverage. The cost for prescription drugs can add up really quickly. While 94% of Medicare Advantage plans include prescription drug coverage, it's important to check to make sure your specific drugs are covered under the plan that you choose to enroll in. One of the great features of Medicare Advantage plans that a lot of our clients really like are the coverage for extra benefits like vision, hearing, and dental. Other examples of benefits that you might see under Medicare Advantage plans include fitness memberships, meal deliveries after hospital stays, and coverage for over-the-counter drugs. The last important factor that we'll talk about today are the CMS Star Ratings. The Centers for Medicare and Medicaid Services has an annual star rating program where health plans are given a star rating from 1 to 5, with 5 being the highest. These star ratings are based on a number of different factors like provider facility inspections, ratings of staff members at different network facilities, and other various quality measures. In summary, it's really important that you aim for a plan that gives you the right balance between your coverage and your cost. Hopefully, the tips that we've been through in this video today will put you on the right path to finding the right plan. But we're always here to answer any questions you have and to help make sure that you're choosing the plan that works best for your preferences. We hope you enjoyed this video, and if you did, don't forget to hit like and subscribe to our channel. We're putting up new videos every week. If you have any questions at all, you can email or call us. Our contact details are included below the video. Thanks for listening. See you next time.